Janelle Woodruff joins us. She's a physical therapist here at Meadville Medical Center. Janelle, thank you for being with us here today.
Thanks for having me.
Let's talk a little bit about what you do here at Meadville Medical Center.
Yeah, so I've been a physical therapist here for almost 10 years, and I've worked both in outpatient and inpatient, but right now I'm working outpatient, and we see all kinds of different diagnoses. I mostly do evaluations, and then we have assistants that carry out the treatment plans and just kind
all sorts of things.
Yeah.
So inpatient, outpatient, most people have a good idea, but just kind of go through maybe some of the differences between the two.
Yeah, for inpatient physical therapy, they're staying at the hospital or in our transitional care unit. We go up to their room or they come down to the therapy gym and they're already on site for us to work with them. For outpatient, they voluntarily show up here to participate in their therapy.
You say that kind of smiling, but the services that are provided are outstanding. We learned about aquatic services. It really is amazing what is available here. And we were talking earlier about sometimes you think, okay, well, it's just for patients, after surgery, but physical therapy applies across the board to just getting back to living your life when maybe you've struggled a little bit, walking upstairs, coming downstairs, getting to your car, in and out of your car, little things like that in life that when you're struggling, you come to really appreciate that ability to be able to do those things.
Yeah, our overall goal for patients is to get their mobility back. So whether it was from an injury, a surgery, just deconditioning. I know a lot of people after the winter didn't get out much. We had a lot of ice, and now that it's time to get out, they're finding that they can't move as well as they want to. And then we also deal with people with diagnoses that are neurodegenerative, so Parkinson's, MS, or if you've had a stroke, conditions like that. So an incident that causes them to move different.
And we're going to actually kind of dive into Parkinson's, and from a therapy standpoint, what's the first step? How do you approach a patient with Parkinson's?
Yeah, so when I started here almost 10 years ago, we didn't really have anyone that specialized in individuals with Parkinson's disease, and the therapy for that is a little different than, say, a total knee replacement. There's different techniques and different ways of cueing those patients to help improve how they move. But the first step is typically they get a script from their doctor, either their PCP or their neurologist, and it comes to my desk. I get them scheduled and we do an evaluation. So I get a baseline measurement of how they're moving at that moment. From that, I come up with exercises for home and for in therapy to help them move better. We always ask what the patient's goals are so that we're working towards things that are meaningful to them. And then we do about 4 weeks of intervention, and then we reassess those outcomes that we tested the first day and kind of see where they are compared to where they want to be. Exercise has a unique effect for patients with Parkinson's disease as it's neuroprotective. So Parkinson's disease is neurodegenerative, but with exercise they can slow the progression or even stop the progression of the disease.
So it sounds like that first step, you're gathering as much information as possible. Mm-hmm. When you're talking with a patient, you mentioned it, just trying to get what their goals are. That sounds like that's a pretty important step in kind of understanding, are we on the right path, or do we need to kind of create something specific for the patient?
Yeah, so I don't want to go in there and everybody's goal isn't to walk a mile. Their goal might be to get to the bathroom more quickly or without falling. So we can't really apply what we think the patient should be doing to what they really want to be doing. So yeah, patient goals are very important in the evaluation process.
And I would imagine you're also looking at the environment that they're in as well. Are you providing recommendations if a house is not set up a certain way, are you saying, hey, if we were able to do this, that would help with the therapy?
Yeah, that's part of our intervening, recommending setting up furniture different, removing rugs in the house, night lights, having a way to call for assistance if they need that. All of that, that kind of falls under the fall prevention umbrella. So if they're telling me that they're having frequent falls, I kind of dive into that a little more deeply and try to figure out what's causing those falls, because falls lead to a lot more issues.
Yeah. How much of it is just that one-on-one with the patient? How much of the conversation are you maybe bringing in family members to just include them on maybe, again, the strategy and helping that patient achieve their goal?
Mm-hmm. Family support's really important for these patients. And if they do have a caregiver that brings them to therapy, I almost always involve them in the initial process, because oftentimes the patient doesn't tell me everything and the caregiver will butt in and say, but remember this. So they're kind of a helpful extra set of eyes there. For Parkinson's disease specifically, their movement degeneration is so slow, they often don't realize that they're moving as poorly as they are. So having that external set of eyes to say, like, no, you shuffle quite a bit, or you're really bent over forward, is helpful too. And then as far as during the exercises, I always teach the caregivers the exercises as well, because if you have another person holding you accountable for doing them, they're more likely to get completed.
Well, it's almost like going to school. Just because the school day's over, you probably still have homework. That you probably have patients where you say, okay, I'm leaving, but I need you to continue to work on these things when I'm not here.
Definitely. Parkinson's disease specifically, they have maximal daily exercises that they're supposed to do every day, even if they've already come to therapy. And my favorite patients to assign those to are former teachers.
Oh, excellent.
I say, you have homework.
What are some common questions that you get from patients, from family members?
I get questions about, will they ever get back to normal? And those are difficult questions to answer. I usually reassure them that exercise is, like I said, neuroprotective, and it's going to be one of the best things to slow the progression of the disease. They ask me, am I going to have to exercise forever? One of the ways I handle that is you wouldn't stop taking your heart medicines. And these exercises are your medicine for your Parkinson's disease. They're helping you move better and move the way you want them, so you take them twice a day, just like you would take some medications. And as long as you continue to take that, you should move the way you want to.
What is the process of a patient getting to your department? Is it going through their primary care physician? Is it going through, what maybe their specialist? Are they calling you directly? What's the best route to get to you?
Yeah, so most of my referrals come from their neurologist. I also accept referrals from PCPs, or if they've been in the hospital, a hospitalist can write a script. A lot of the therapists do have what we call direct access, but we don't have it set up for them to come directly to us. Direct access means we could treat you for 30 days without a script, but that's not completely set up here yet.
It sounds like it's a very challenging job, but maybe rewarding in the sense that you are helping somebody through a tough time in their life. What are some things that you've taken away from what you do here?
Yeah, it gets difficult in that you aren't going to get every patient back to their goals, but most patients do achieve their goals, so that is rewarding to see that. And
when it might be just them realizing they can accomplish, maybe not the whole goal as you said, but just a little bit of that.
Yeah, or changing the way they do things, or the way that they used to golf, or something like that. Getting the most mobility and like the best quality of life with this challenging diagnosis.
Do Are patients surprised to know there is physical therapy geared towards just Parkinson's?
Most of the time when they get the diagnosis, either themselves or a family member has started researching, and anything that you type in on the internet is going to tell you exercise is important for this diagnosis. What they're more surprised about is that we have someone in Meadville that specializes in physical therapy for Parkinson's disease. So once they find that out, then they get connected with me and get going with therapy.
Janelle, at the end of the day, what do you do to kind of relax and unwind?
I don't know what relax means.
Okay. Any hobbies?
Yeah, so I have 2 boys, 2-year-old and a 7-year-old. And my husband and I have a side hustle as a flower farm. So,
a flower farm?
Yeah, I'm a flower farmer. I also teach in an adjunct professor at Gannon University in the adult neurological disease course. So I do that during the spring semester.
Wow.
I stay busy.
That's great.
Yeah.
Favorite movie?
Don't watch TV.
All right.
There's no time for
that. How
that.
about book? Any books? Music?
No. Sorry.
No? Just always working.
I like the Pirates. I like to
there
watch
you go.
baseball games. I was there this weekend.
Were you?
Yeah, Saturday when they lost.
That's been the theme of the season. That's okay. Maybe you could be the next skipper.
Yeah.
Janelle, we learned an awful lot. Is there anything that you think our audience should know about physical therapy services offered here at Meadville Medical Center?
We have a lot of really great therapists with a lot of different specialties. And I think it's a really great place to get your physical therapy.
That's great. We appreciate your time.
Thanks.
Thanks so much for joining us.
Thanks for having me.
And thank you for being with us as well.